Welcome back to the lecture of acute liver disease in children. I'm Dr. Amel Elfaramawy, professor of pediatrics at Shams University. This is the last segment of this lecture, and you know now the liver diseases with acute presentation as viral hepatitis, autoimmune hepatitis, metabolic liver disease, drug-induced liver injury, and vascular disease of the liver. Now it's time to explore the most dangerous complication of acute liver disease, which is acute liver failure or fulminant hepatic failure. Acute liver failure in children is defined as acute onset of liver disease with no known previous evidence of chronic liver disease, in which hepatic-based coagulopathy occurs, as evident by INR more than 2, not corrected by parenteral vitamin K. Unlike adults, encephalopathy may be absent or late. Hepatic encephalopathy must only be present if the INR is 1.5 to 1.9. This table shows the common identifiable causes of acute liver failure according to age, but actually in many cases an identifiable cause is not found. The typical scenario is a previously healthy child with no history of major medical problems, initially has what appears to be ordinary hepatitis. Over the next days to weeks, the child doesn't improve or has worsening of symptoms. Parents may note increasing lethargy, occasionally hallucination, and hemorrhagic diathesis. Hepatic encephalopathy is a brain dysfunction that occurs as a result of acute hepatic dysfunction. The pathogenesis of hepatic encephalopathy in acute liver failure can be attributed to accumulation of neurotoxic substances, ammonia, and endogenous benzodiazepine-like substances as a consequence of decreased clearance due to hepatocellular failure. Hepatic encephalopathy in liver cirrhosis is also related to these neurotoxic substances, in addition to shunting of ammonia to the brain due to portosystemic shunts and increase in permeability of blood-brain barrier. The stages of hepatic encephalopathy in children is different than in adults, as you see in this table, as we cannot depend on psychometric analysis that is used for evaluation of adults in children. Management of acute liver failure should be in an ICU setting. It is directed at life support and prevention and treatment of complications to allow recovery to occur, or until liver transplantation can be done. Symptomatic treatment for hepatic encephalopathy, aiming to decrease ammonia production by lowering daily protein intake and gut sterilization to get rid of bacteria producing ammonia by the use of neomycin, lactulose, and enemas, in addition to plasmapheresis or hemodialysis for removal of ammonia from the blood. Maintaining blood sugar, fluids, electrolytes, correction of coagulopathy is mandatory. This brings me to the end of this lecture. Thank you for listening. I'll be glad to answer your questions in the face-to-face session. So till then, be ready.